Shamrock. I'm an occupational therapist and certified hand therapist for Atlantic Physical Therapy. I work at the Ocean Pines, Berlin location. I'm here today with a gentleman that has scleroderma. It's a connective tissue disorder that causes thickening of the tissue and the skin. It can also cause vascular problems. So we're working on, you can see there's a lot of web space or finger tightness here. We're going to demonstrate a couple exercises that can be done to help stretch out the tissue and make the fingers more flexible and the wrist. So go ahead, we're going to start showing some to stretch out the web spaces. Go ahead and spread the fingers. We want to keep the hands flat and spread out the fingers as wide as we can. We're going to hold for a few seconds and back in. I'm going to do a couple of those. So we want to stretch everything out, including the thumb, to stretch out the web space here as well, and back in. Good. So that's one exercise. We would repeat that 10 to 20 times. Another one that we want to do is keeping the hands flat on the table. We want to try to lift one finger at a time. So let's go ahead and try to lift. Good. Hold for a second or two. Go ahead and lift, and lift, and lift, and lift. Good, and we would repeat that 10 to 20 times on each hand. Another great one to stretch out the web spaces is lacing the fingers. So let's go ahead and try that. We try to get the fingers in as much as we can. Good, that's it, and let's come down like this. Good, bend the fingers. Good, and I just want to say that we did start with a paraffin treatment, a warm wax treatment to kind of loosen up the fingers ahead of time. Good, so in this position, we're just going to try to move the hands and wrists back and forth just a little bit. Good. Good. Next exercise is going to be to stretch out the wrist and the fingers. The flexors are very tight. We're going to try to bring the hands together. And we call this one a prayer stretch, where we keep the palms together and we try to bring the elbows out to the side. Good, and we're going to hold that for about 15 seconds. Good, and then we can add a little wrist motion with that to help stretch it out even further. Good, that's it. And again, we would repeat that about 5 to 10 times. So I'm going to show one more with the ball. This is a great wrist and finger stretch. So we're just going to move forward with like that, keeping the palm and fingers on the ball to stretch out the wrist. Good, and then we're going to bring the ball back, keeping the palm on the ball to get a nice stretch. Good, and we want to do it nice and slowly. Good, and you can just show how it can get a nice stretch through the wrist and the fingers. Good, and come on back. So I hope that helps. We wanted to show a couple exercises that you can do for scleroderma to improve flexibility and finger range of motion. Thanks for